Guys, it's Harmony with Pregnancy, Birth, Babies, and Beyond, and I am going to be doing a little update on where I am. I am now, I think, 39 weeks, 4 days, or is it 5 days? I don't know. Anyway, I only have a few days left, and I am so done. They really do say that there's that big weight, and it's miserable, and they're not kidding. But yeah, my little one is definitely still in there, and we're ready to get him out as soon as possible. He's still breech. So today my little video vlog is going to be actually about a birth plan. So I had originally planned a very different birth plan because I was going to do it at the birth center and work, with my midwife, and we're very much on the same, realm of thinking. When you birth at a birth center, you have a much better idea of what you're going to get in terms of natural, which is what I want. So because I am doing it at a hospital, I've written out a pretty detailed birth plan, and I really recommend any mom look up these things. And so I'm going to go over what I wrote down for mine and explain a little bit of it as fast as I can, because it could take a while since I have a whole lot on here. I have 3 pages of different birth plan stuff. But this is just what you would give your nurse, your doctor, at the hospital, so that they know what it is that you want. Also, if you have a doula or your partner, in my case, my midwife, who is also my sister, will be there. So she would have a copy of this so that they know that what your preferences are when you're actually in labor and you can't really think for yourself, because that's normally when things happen that you didn't know were going to happen, or you weren't aware of, and then you don't get the experience that you really wanted. So for labor and delivery, I wrote a couple of things. The general things that I would really like for my labor and delivery at the hospital is obviously I wanted a natural and unmedicated birth. I don't want to be induced, so I didn't want Pitocin or anything. But if perchance I needed to be induced, I'd really like them to try the Foley bulb induction method. So I don't want Pitocin, because I hear that makes some really awful labors. And most of the time, if you end up with Pitocin, you're going to end up with an epidural as well, because the labor is so painful. Foley bulb is like these balloons that they insert into your cervix, and then they blow them up, and it helps dilate you. And then when you're dilated, they just come out. So it's much more of a natural method to use. So I requested that they would use that instead of, or if in case I needed it, not Pitocin. I didn't want medication or nurses to strip my membranes or break my water. And I said not to do those things unless I'm aware of it and I provide consent. I mean, there may be situations where I would want that, but I would want them to be known. I wouldn't want them just going in there and doing that. Nurses sometimes have been known to do that. They'll go check you at the hospital and strip your membranes or break your water or whatever, and you didn't even know. I said I would like to work with my doulas and my midwives during labor and be able to move freely and be in whatever position is most comfortable. So I don't want to be strapped to the bed. I wanted to have a heparin lock, so instead of being hooked up to the IV all the time, I will have to be on it because I am strep B positive, so they're going to have to give me intravenous antibiotics. So I will have to have it, and they'll have it there just in case of emergencies anyway. But I would like to be able to take it out and do what I need. No forceps unless it's an absolute emergency. Those are horrible. I don't know why any mom would want to do it. Again, I guess I don't know the circumstances. Maybe there are situations where they're necessary. But unless they're absolutely 100% necessary, I do not want them used. And I would want my midwife and my doula and my husband, partner, to stay with me at all the time, the whole time. I want a quiet room with lights dimmed. I'm actually planning to bring myself a string of Christmas lights. I heard this from another mom. And I hate hospital white lights. They make me feel just awful. So I am going to bring those with me And I mean, I'll just turn off the lights probably and just have my Christmas lights. I want my husband and my doula to be able to coach me. I don't want a hospital gown. These are all my preferences. You may not care at all, but this is what I want. I'm going to bring my own gown and wear it. I hate hospital gowns. It makes me feel like a freaking patient in a ward. I hate it. Anyway, I don't want any cheerleading during pushing stage, so I don't want them going push, 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 and being noisy and crazy. I just want it to be natural. And allow me to work with my body, and I want to be able to eat and drink as I desire. A lot of the time they won't let you eat and drink, and I've always don't understand that. They'll give you ice chips, I think, sometimes, but they won't give you food. So if at all possible, I'd like to be able to do that. I need strength, right? I don't want vaginal exams unless, of course, requested. So I don't want people just coming in and doing a vaginal exam on me whenever. They sometimes will do it like every hour or whatever. I don't know what it is, but I don't want that. They can be really painful from what I hear. For pain relief, I would like to use massage, hot therapy, shower, birthing ball, or Rebozo technique. These are all very natural techniques. I don't want, again, to have medication. I do not want to be offered an epidural or pain medication. When I'm hurting really bad, I don't want it to be said, hey, we can help you, and in a moment of weakness, me do this when I really did not want to have that happen. So I don't want them to really even offer. If I want it, I know it's there, I can request it. I do not, in terms of fetal monitoring, I want minimal monitoring, intermittent if possible. I do not want the fetal monitoring where they stick it up and monitor on the top of the head. I really, really don't want that. Again, that confines you to a bed. So no internal fetal monitoring at all, unless it is an absolute emergency. But most of the time, that's not. In terms of pushing and tearing, I would like to be coached to help not tear. But I really, I think some of the things I'm most scared of, and I know people don't understand this, but I don't understand why they would do it. They say that a natural tear is easier to heal than an episiotomy, and episiotomy is where they take it and they literally cut your vagina. And I've heard so many horror stories about this. So I talked to my doctor and I said, please don't do this. I don't want an episiotomy. It's absolutely necessary, and I'm going to literally, whatever, blow out my whole entire, vagina, then okay. But that isn't usually what happens. In case of a C-section, now, in my case, it could very well happen. He is breech. It is high risk. I'm hoping that it doesn't. But if it does, I did have some requests on that. A gentle C-section, if you don't know what that is, you should look it up. It's where they will, lower the plastic cover thing so you can watch your baby actually being delivered. It also is... they have skin to skin, so they will immediately put the baby on your chest while they stitch you up. So I asked for that immediate skin to skin. If I can't, to ask for his dad to be able to conduct immediate skin to skin. Again, that's unless there's an emergency or something, and that's not a possibility. I do not want any additional drugs to be made to relax, because drugs will make it where you aren't coercive. That's, I don't know what the word is. Something where you can pay attention and you know what's going on. I want to be able to know what's going on, and if possible, I would rather have an epidural or spinal block administered instead of being completely knocked out. But in my case, I don't want an emergency. I don't want a C-section unless it's an emergency. So most likely they're going to put me under, because that's usually what they do in an emergency situation. But I'm just saying, if they can, I would rather have an epidural. This is really important because if you ever want to have a VBAC, which is a vaginal birth after C-section, so if I had a C-section, a lot of doctors won't do it unless you have double layer sutures and you have a horizontal versus a normal vertical cut in the belly. So I specifically asked for double layer sutures and that it be a horizontal cut. And I really prefer, again, I don't want to feel like I'm in an insane asylum. I do not want my arms to be stripped down. Again, I want my gown to be lowered to allow holding and breastfeeding of baby. And I want, of course, in the case of an emergency, I would like for the baby and the mom, me and my baby, to be reunited as soon as possible. In terms of afterbirth, I would really immediately after birth, I would like for as much silence and quietness. I don't want a lot of noise, craziness like it often gets. Again, this baby, he just went through this traumatic experience. I want him to have a chance to recover and feel in a serene, calm atmosphere. So as much silence as possible. As soon as we can, if it's a normal birth, immediately put the baby on the chest. I don't want my little boy wiped down. Vernix is very good for the baby's skin. I don't want to give him a bath. It helps protect them from like bacteria and stuff. And if it is necessary to stitch me, so if I tear something, I would like it to be done quicker than later, because the oxytocin and everything in your body can help with the pain when you're being stitched up, and I want to be just a local anesthetic used. I don't want Pitocin to deliver the placenta. I would like it to just be delivered on its own. I don't want Pitocin ever. That stuff sounds awful. If possible, again, I want my husband to cut the umbilical cord, and I want it to be until after it stops pulsating and it turns white. I'm a naturalist, and again, I know those are the baby's white blood cells. I know there's lots of other options, and if you don't want it, that's fine. For me, I am pretty strong for allowing the baby to get all of the not the nutrients, but the white blood cells and everything, these stem cells that he can, which come from the placenta. I want the golden hour, which is where they'll hold off on any tests, weighing, etc., until the baby is successfully nursed, and there's this golden hour where the baby is alert, and it allows you to bond with your baby. For the Hep B vax, I do not want them administering it at all, period. That's something that I want to be able to decide to do later if I do. For me, personally, I don't understand why they have to administer this. Again, hepatitis B is a sexually transmitted disease that's it's not even, the likelihood of the baby getting hepatitis B is so super low. And I don't understand all the reasons why they would do it, but I personally am choosing to not have that vaccination at birth. If in the future I do choose to have vaccinations, I will have to, I plan to travel outside of the country, so yes, vaccinations are probably going to happen at some point, but I want to hold off as long as possible so that my baby's immune system can develop and be strengthened before administering those kinds of foreign toxins, whatever it is, not toxins, although there are, we get on that whole subject later. But yeah, so I want them to hold that off. For the antibiotic treatment, that's the stuff that they put in the eyes to help the babies in case they're exposed to gonorrhea or chlamydia, so they don't go blind or anything. I want it delayed. They can put it in the eyes, but I want it delayed until that golden hour is over, when the baby and the mom and dad have had some bonding time. And for the vitamin K shot, I thought about not going this route and not using vitamin K and just doing it orally myself, but I chose not to, because apparently breech babies, which he is, tend to have higher rates of bleeding and tend to be more at risk for like the hemorrhaging and everything that comes if you don't have the vitamin K. So I went ahead and said, yes, go ahead and give them the vitamin K shot. But I want the preservative-free. You don't have to have one with the preservative, so I requested a preservative-free shot only. For the baby's care, I don't want any formula, any sugar water, pacifiers, or bottles. I'm planning to exclusively breastfeed. The whole bottle thing, will be addressed later. I do not want the baby separated from me. I do not want him taken to the nursery. I want all the physical exams and procedures done in the room with me so that I'm aware and can watch. And I don't want anything really done to my baby without my informed consent. I don't want the baby bathed, as I said earlier. I'll bathe him myself, my own shampoos, my own stuff. That's something that I think should be left up to me. Again, I don't want formula. I plan to breastfeed exclusively, and this is a personal choice for my husband and I. But we have chosen not to have him circumcised. They will circumcise your child if you do want to have them circumcised. There's some recommendations. I recommend you look into it instead of having it right at birth. Sometimes it's a lot easier on the baby if you wait for 7 days and do it by a rabbi. They can be a lot easier on them. But personally, I am not having my baby boy circumcised, so I requested that. For that was all my hospital requests. I had a few ones that I specifically did for the birth center, but I'm not going to go over those because they're kind of, this is just, if he happens to turn, they include stuff like, you know, having the tub, because I really wanted to labor in the tub, which I won't get to do. No rigorous, like, bulb syringing, you know, requesting a mirror so you can watch, stuff like that. Basic stuff that's not super important to me, but, you know, it would be nice to have. So, again, this has already gotten to be 15 minutes, so if you stayed around the whole time, I'm kind of impressed. But that's my birth plan. I recommend that if you're a mom and you're going to be in the hospital or a birth center or whatever, is look into what you really want. Be educated. Make these decisions for yourself and know what you want. That way when you walk into the birth, you have power. With information comes power, and the worst thing, in my opinion, would be to walk into a birth completely powerless. This is your body, this is your child. Know what you want, and be able to have something that like this that you can give people and be like, hey, this is what I want. So that when you're in birth and you're in labor and you're miserable, you don't have to try and communicate those. You already have it written down. So anyway, that's my birth plan, and I hope you enjoyed. I hope it made you think about some things. Look into it yourself, see what you want. And I guess I'll see you next time. Next time we're probably going to talk, and it'll probably be really soon, about prodromal labor, because I didn't know about it until literally just recently. So we'll get onto that video later, because this one's already way too long. Alright, talk to you later, guys. Bye.